Welcome, dear viewers, here in our format Nature Medicine. Today we talk again about gold implants. Please stay tuned. Gold implants are a key to getting rid of pain and also to prevent any orthopedic surgery. You will hear a doctor explain this to you today, but you will also hear a patient who experienced it herself. Stay tuned, we'll get started right away. Here we are again, and now I would like to introduce you to my guests. On the one hand, Dr. Harald Burgard. Welcome, dear Harald. Good morning, dear Alexander. And on the other hand, we have a patient with us, Mrs. Gabriele Schabbach Schuh. Welcome, dear Mrs. Schabbach Schuh.
I greet you too.
It's very nice of you to introduce yourself as a patient. I would like to start with you right away. Please tell me, what was a problem for you? This problem, and what did you try?
The problem started many years ago. I don't remember exactly when. I noticed that when I walked longer distances, I got knee pain. In the beginning, you just take it and think, well, it happens again. But then it built up so much that at some point I noticed that if we had any plans or I just wanted to go shopping, that I thought about how long the walk is, where is a cafe, or where can I sit down to rest and be able to go on again.
Oh dear.
And that severely limited my life at first. But it went so gradual that I somehow only accepted it for a while.
Do you call it arthrosis, the beginning of an arthrosis?
Yes, exactly, that's still coming. And at some point it got so bad that I started only going with crutches. So if I had a longer distance, I only went with crutches. And then I went to a doctor and he told me something about overload syndrome from arthrosis. I went to the MRT, again the same statement, you will no longer get past an artificial knee at some point. And I knew I didn't want that. And that went on, although I have known Dr. Burgard for many years, but we don't see each other that often, usually. It went on like that at first. With pain pills, I didn't like that. Then I tried it with natural remedies, like dolotepin or something similar, to limit the damage. But it got worse and worse. I then went to an orthopedic surgeon, whom I had known for a long time. And he gave me hyaluronic injections in both knees. As I said, both knees were affected, the left a little stronger. I then got 10 hyaluronic injections in the knee, in the left and in the right. Then I was very happy, it was a little better. With a little better, I was already satisfied. But at some point that was no longer good either. And that went on a bit until I was at Dr. Burgard for some other reason and we came to talk on the knee and he told me about the gold implant. I then first informed myself about it, read and looked it up. Then I said to Dr. Burgard, I would like to have that now, in both knees. That was in December 2021. Dr. Burgard then told me, he does it in the more affected knee, i.e. in the left, and let's see what happens. Maybe that would be enough and you wouldn't need the right anymore. So I had this intervention done. Since I have the greatest trust in Dr. Burgard and have known him for a long time, I didn't think about the implant. It was clear to me that he would do everything right and well. The implant was also, I have to say, very easy. There were a few sedative injections, which I also noticed. I didn't notice anything at all about the actual implantation of the gold. I was completely relaxed. Then we waited and looked what would happen. We then waited a few weeks when I told Dr. Burgard I don't think much has happened yet.
Dem Dr. Burgard sagte, es hat sich, glaube ich, noch nicht so viel getan.
But things come slowly and all of a sudden the pain was gone. When pain is gone, you don't notice it either.
Dann fällt's einem ja erstmal auch nicht auf.
At some point someone asked me about knee pain and I thought, my God, I had that myself. Everything is gone. Then I called Dr. Burgard and told him that 90% of the pain was gone. And the right knee, surprisingly, too. I was still a little careful and my walks got longer and longer. I was on vacation now. I also told Dr. Burgard about these days. I was no longer able to brake while walking. My husband, who is a really good runner, said, my God, you can't go this detour and this detour. When do we finally go back? I said, when I feel my knees. I think my husband soon hoped that I would feel my knees. But I am so happy and grateful that I can walk again. It's incredible. I really want to tell people, try it, it's worth it. Don't do this detour over the escalator, but take the elevator. I can really only advise you from my own experience. It was worth it for me 100%.
Wow. Congratulations.
Thank you. And again, thank you very much to Dr. Burgard.
It is really important that he enjoys it and gets it. But I also want a lot of doctors to hear that there is such a therapy form, that they make themselves familiar with it and that people who are affected have the chance to have such a therapy form.
Menschen, die betroffen sind, die Chance haben, eine solche Therapieform auch zu beziehen. Weil noch ist sie sehr,
It is very, very little known, except in veterinary medicine, but in school medicine there is orthopedic surgery, a new knee. I'm so happy to hear that. You said it took a while, a few weeks.
Yes, it took a while.
And I think that's logical, because I understand that gold releases ions and ultimately reduces inflammation. But the second knee?
I still don't understand that.
Then let's ask him quickly. He's sitting there. Dear Harald, what happened to the second one?
Yes, it is often the case that one joint becomes painful, one joint has arthrosis, which is leading, and then of course you strain to spare one joint, the other more, and of course it hurts more. Even if there is arthrosis in there, it does not necessarily have to hurt. But if the injured joint, knee in this case, gets better, then the other is also relieved. And that often leads from our experience simply to the fact that people are then pain-free. That's why we always do one first to weight off, and with most patients, we've just seen that for years, with most patients it's all good. And then I don't have to do two at once, but weight off first and then do the second. If it is actually so bad, which also happens, I rather go the way to say we treat the worst first. Most of the time it is actually good. We always have people who come with hip pain, they also have knee pain, they also have spine pain, because this knee arthrosis protrudes up and down. I don't go there either, even if there is an arthrosis in the knee, and treat it, but I only do the hip in this case, and in most cases the pain is then in the knee and in the lumbar spine also gone. So first see what's happening, and if the patient is fine, then you don't have to treat it unnecessarily.
Dear Ms. Schabbach Schuh, what kind of imaging materials did you have to provide the doctor so that he can take a picture of your knee?
To be honest, I don't know that anymore. Then I'll ask him quickly. He's sitting there.
Was there an MRT, X-ray? Yes, in general, the patients either bring a normal X-ray in two levels where you can see the knee from the front and from the side or find an MRT. I always have to rule out that there is no tumor in it or that there is a special heavy axillary failure or that the bone is destroyed and so on. You have to be sure that you are doing something that helps people and not that you are making an intervention that is completely stupid. If the bone was destroyed in such a way that it would have already shrunk, that it is so hollow under the knuckle of the bone that it already has a break, that is rare, but something like that also exists, then you don't do a gold implantation. But that is very rare. You always have to exclude such things, of course also a bone tumor. You just need an imaging material for that. Otherwise it is always necessary that you have the person in your hand. That I feel the knee and then feel where I have to put the gold implant. You can't see that in the picture, but you just have to have an image in the preparation so that you can see what the joint looks like, how far the knuckle is broken and so on.
So it's not just blindly operated or set, but it is looked at where it has to go exactly.
I ask every patient to have the image beforehand.
Yes, I am just happy to be able to bring such stories on TV, and I would just like to ask you, do you have any appeal to our viewers? How long should you wait until you do something like this?
I don't think I would wait long today at all. I really can't tell you when I would go directly, but in any case I wouldn't wait for years. I think today I would say the thing, but you can always say it in retrospect. Give it 2 months, at most 3 months, and then I would say, okay, something is wrong here. I would look for contact with Dr. Burgard and I would say, give him the thing very simply, very trustworthy. He will do it right.
Did you have any side effects after the operation? Was there any pain? So even bigger?
No, not at all.
You could still go again, just with pain?
Yes, I just went on with my old trot, more or less, and just waited for the success, which then came slowly.
Und habe halt auf den Erfolg gewartet, der ja dann auch irgendwie schleichend kam. Ja?
And I can only say again, dear viewers, please don't wait so long in your own interest.
Bitte wartet nicht so lange in eurem eigenen Interesse.
The intervention is really minimal. I would tell you if it was painful and bad, but it wasn't at all, and look for Dr. Burgard. He will help you in this case guaranteed.
Suchen Sie den Dr. Burgard auf, der wird Ihnen in diesem Fall garantiert weiterhelfen.
And I am a fan of the gold implantation. I talk about it everywhere. My GP is also very interested. Everyone is very interested. What comes to Dr. Burgard in retrospect, I can't assess exactly. But for me it was worth gold.
And you are now worth a bit more.
My patients said, you jump around so happily. I'm actually a very cheerful person, and there was something nice for Christmas, because it was February or something. I said yes, there was gold. Oh, did they get a necklace or a ring? Then I said, no, I have my gold in my knees, so one steals it from me.
Great, great. I thank you very much, dear Gabriele Schabbach Schuh. That was very nice of you. She will get a link from us, so that you can see how you are on TV. Thank you very much for sharing your message. With pleasure, have a nice day. Likewise, all the best. Yes, dear Harald, we have just flashed and would like to ask the viewers who are watching for the first time today, what exactly happens when you put the gold into these problem zones?
Yes, at the moment when I put gold into a tissue, the effect of gold begins. Gold is the metal with the strongest anti-inflammatory effect. In mummies, which were mummified 7,000 years ago, it was found that gold, for example, was in the teeth to reduce dental inflammation. It was introduced into the tissue for rejuvenation. It was also introduced decades ago, gold threads for tissue rejuvenation. It has been found in studies, when I put gold into a tissue, that gold collagen structures arise, and then in 1975, the veterinarian Dirk started to use gold in hip dysplasia in sheep dogs.
Der Tierarzt Dirks bei Tieren angefangen, Gold bei Hüftdysplasien bei Schäferhunden einzusetzen. Und
gold acts in such a way, when I put it into the tissue, that tissue cells that sit there, macrophages, mast cells and so on, that they release ions from the gold, which then lead to the fact that these inflammatory substances do not develop further.
Die dann wiederum dazu führen, dass diese Entzündungsbotenstoffe, die Schwellungen und Entzündungen machen, dass die gar nicht erst weiter gebildet werden.
That means their production goes back, and therefore the pain goes away. And since the gold stays there for a lifetime and this gold release runs permanently, the patient will also be permanently pain-free or pain-reduced. You even know from studies, if the patient is now burdened, like Ms. Schabbach Schuh for example, she is now doing a big hike, and she would then get pain afterwards, because she has now overloaded the joint. Then studies have shown that the body releases a little more gold sugar, and then 1 or 2 days later it goes back again. That's what the patients report, when they exaggerate, that they have 2 more pains per day, and this is a physical biochemical process which takes place, and the other interesting process is actually the fact that gold, if it is in the tissue, attracts stem cells, which actually promote the regeneration of the tissue.
Der weitere, eben interessante Vorgang ist tatsächlich der, dass Gold, wenn es im Gewebe ist, Stammzellen anlockt, die tatsächlich dort die Regeneration des Gewebes fördern.
And that also leads to the fact that processes arise again and again, which we can observe, that the cartilage improved, because for a long time we have already seen that patients were completely pain-free afterwards, and when a follow-up was done, there was hardly any narrowing or constriction to be seen.
Dass Patienten hinterher komplett beschwerdefrei waren und wenn man dann eine Nachuntersuchung gemacht hat, dass dann kaum noch eine Verengung oder eine Engstelle zu sehen war.
That surprised me at first, because I couldn't explain it to myself, but that is the only explainable way, that it is due to the stem cell repair.
So you have known it for a long time, but it has gone a bit into oblivion, that instead of an orthopedic operation, we would have to go to the vet, right?
Und wenn wir Schweizer das haben möchten, statt eine orthopädische Operation, müssten wir zum Tierarzt gehen, oder?
No, he's not allowed to do that. That was a joke. Of course, we have to make sure that many of your colleagues hear about it, and I would like to ask you to address your colleagues directly to the camera, who are probably watching today.
Direkt in die Kamera deine Kollegen anzusprechen, die heute ganz bestimmt auch zusehen. Was könntest du ihnen raten?
They should also do that in their practice, if they are trained for it, right?
Yes, of course. If you want to do that, you have to have the opportunity to be able to operate. You have to learn this procedure, and you have to want it.
Dann auch diese Vorgehensweise erlernen und man muss es auch wollen.
Many colleagues who are currently working in the healthcare medical field do what the healthcare doctor does, only the conservative therapy, i.e. exercises, painkillers and so on, fails, that you go on to the operation and do a joint replacement.
Also Beübungen, Schmerzmittel und so weiter versagt, dass man dann halt zur Operation übergeht und einen Gelenkersatz macht.
That is also what is paid for, and that is probably what leads to that this type of joint replacement therapy is still being done.
Dass auch diese Art der Ersatztherapie halt weiterhin gemacht wird. Ja?
I am a private doctor, I have more time for patients, and I always try to destroy as little as possible in everything I do.
Und insofern kann ich auch andere Dinge machen und ich versuche immer so wenig wie möglich zerstörend zu arbeiten, bei allem, was ich tue.
And if possible, to eliminate the causes. If the knee is broken, I don't need to go to the cause anymore, then it's just broken. That's why you can help a lot of people with such non-invasive measures. But to have the illusion that suddenly, when we explain it, every healthcare doctor will do it.
Der gebe ich mich gar nicht hin, weil das wird nicht funktionieren. Ja? Die Strukturierung ist so, Gelenkersatz, das wird bezahlt, Punkt.
The gold implantation is not paid by the legal insurance companies at all. By the private insurance companies sometimes, and that is of course enough reason for many colleagues. If there are not thousands of studies, to say we just stay on track.
Well, you once told me what it costs, and I can only say that it can actually be financed. That is not something that goes into the tens of thousands, on the contrary, and if you are pain-free so quickly, then it is worth it. And if I can maintain my own structures, that's what I hear from all the experts, the most important thing there is.
Your own body is still the best, your own teeth are the best, you still go best with your own joints. As I said, there are limits, but if you do it early, it is of course best. Usually they come when there is a joint replacement already planned, but even then you can still help the most, and I think that's fantastic, and you keep your joint.
Im Grunde ein Gelenkersatz ansteht, aber selbst dann kann man den allermeisten noch sehr, sehr gut helfen. Und das finde ich fantastisch. Und man behält sein Gelenk. Man kann ja auch,
even if you have a young person, you come to a football player career with 55 or 50 and have a problem, you can replace the knee as often as you like, or the hip, you can maybe keep it for 10, 15, maybe even 20 years. You have to replace it, you can do that once, but you can't do it 2 to 3 times.
Da muss man sie ersetzen, das kannst du einmal machen, aber du kannst das nicht 2, 3-mal machen. Das heißt, je jünger jemand ist, umso
You also have to be able to delay the time until you make a joint replacement at all. Usually you don't need one after the golden implantation, but if you do, the later the better. And then of course you have the other group, old people who are not even capable of surgery. They come, they have high risks for a full anesthesia, or they have risks for wound healing disorders. I don't have all of that with the golden implantation, I do that with needle technology. I don't need a full anesthesia, I don't have to anesthetize people, I do it with local anesthesia. They don't become immobile, which is often a problem with old people. Then the blood circulation is bad, then they need a stomach injection. I don't have that with the golden implantation, I give them a local anesthesia. The effect stops after an hour, they get up after the treatment or after the golden implantation, after the surgery, and go home as normal as they came. 1 of 10 has a little more pain in one arm. He takes a pill, ibuprofen or something, but they can manage their normal everyday life, they can go to work the next day. They don't need to be out for weeks or to initiate rehabilitation measures. That's a huge advantage for many groups.
And in the end, it's not the doctor who decides about the patient and his way of healing, but the patient himself decides what he wants.
Always. He has to be informed.
He has to know that there are different options. And that's exactly the appeal to all of our therapists and doctors, who are also watching right now and are using this program as further education. They could also contact you. You have an academy in Germany, don't you?
The European Academy for Golden Implantation, where we offer training. As I said before, due to Corona, unfortunately everything has been blocked in the last 2 years. But I hope that it can start again soon, and then we will resume the training.
Are you the only one in Europe who offers this training in German?
No. Dr. Intrizzi works with me. Dr. Kierkegaard is still available to advise us. He was the first person to do the golden implantation. He is an experienced specialist, and we also have a scientific council and so on. So there are several people who can work with us.
Another question, an assessment question, about the success rate. If 10 people come to you with such problems, and you put these implants on, how many people can expect it to get better afterwards?
As I said, people usually come to us when it's too late anyway. Basically, when the implant is planned. As Dr. Intrizzi and I and other colleagues always ask, we have a relatively large collection of patient information and know that about 80% of the patients have a success rate between 80 and 100%. We have about 5% of patients who have no improvement. I looked it up and thought about the reason for this. There were some very strongly represented spines where it was difficult. For example, a rheumatologist has a cortisone, which simply makes the release of the gold difficult or sometimes impossible.
erschwert oder teilweise unmöglich macht.
Because this cortisone supply, of course, also blocks the activity of the defensive cells.
Blockiert natürlich auch die Aktivität der Abwehrzellen. Und die
They are
sind
responsible for the release of the gold.
Und,
Then we have a
dann
percentage
haben
of
wir noch
patients who have very strong
Patienten, die
changes.
sehr starke, Veränderungen haben. Da
We
haben
have
wir
at least 50 to 80% improvement.
80% Verbesserung. Das
That's
sind
about
etwa
20%.
Ja.
In patients with shoulder pain, we have seen 100% success. I have never had one, neither have the other colleagues, as far as I have noticed so far, who were not pain-free afterwards. The shoulder is very grateful. Spine too. If the spine is very twisted and the pressure ratios are extremely poor, then it gets better, but maybe not so much. But often it is a huge advantage for these people if they have some improvement, and this is a therapy where you can say with all certainty that it helps many people very well.
Ja, aber es ist schon eine Therapie, bei der man mit Fug und Recht sagen kann, dass sie vielen Leuten sehr, sehr gut hilft.
I used to have patients, my topic is chronic pain, chronic autoimmune diseases and so on, to treat. Then people came and said, can we do something if we are already there for our atrocious knee, shoulder, whatever? Then, of course, with the joints, which were usually K3 or K4, I also sprayed hyaluronic intra-articularly into the joint or tried platelet-rich plasma. But with K3 and K4 atrocious, i.e. with advanced atrocious, you always have to repeat that. It does not bring any really satisfying long-term effects. When I got to know the platelet-rich plasma, I realized that if you do that, people are pain-free with a single intervention. I thought that was cool and it works. And we hear it too.
For me, with what you are doing, you are already a little hero. No, a big hero. Because heroes are for me people who help other people to become pain-free. And this kind of service you offer, which hopefully can spread a lot, could reduce so much suffering. And maybe also for you, dear viewers, tomorrow I will go to him in practice with my mother. We will do the operation on my mother's knee tomorrow. And there she will ask for an interview about how the pain level is. She also has an arthrosis, I think a very bad one. She said it is very painful. And then I will document the course of her operation. And then I will ask my mother to do an interview to describe how she experienced it all and what the pain level looks like now. I would like to prepare her for this documentation. Personally, I am so convinced that it should be done before you really have to resort to the last resort, i.e. orthopedic operations. In this sense, thank you very much. This was Dr. Harald Burgard for you. And I wish you, dear viewers, that you can distribute this program to a lot of people, please, who are also affected, be it on the ankles and knee problems, on the hips, on the shoulders or on the elbow and so on. Fingers work also, right?
Yes, unless someone has a polyarthrosis or a rheumatoid disease, I prefer to go to the causes so that the causes go back and the whole thing does not continue.
Da gehe ich lieber an die Ursachen, damit die Ursachen zurückgehen und das Ganze nicht weitergeht.
Well, I mean, it's not just put blindly, it's discussed with a doctor.
Yes, exactly. And spine complaints, pain in the spine are always a big topic, be it through osteoporosis, be it because people had a disc herniation, that they have narrow spines and so on. So there are a lot of diseases that you can work with very effectively.
Thank you very much.
You're welcome.
All the best. See you next time.